evening, everyone. I am Harsha, representing a group called Science Integra, and I extend a warm welcome you all for the 24th episode of Maha Smiles Cleft Care for Every Child. So, this event is organized by AMOX in collaboration with Smile Train India and the Foxy Public Awareness Committee of and with the aim of raising awareness about cleft lip and cleft palate condition in children. So it's my pleasure to introduce you all to Ms. Charvi, who is the program officer of Smile in India. Over to you, Charvi.
Thank you, Harsha. Can you please share the slides? It gives me great pleasure to share how Smile Train and Foxy have come together in a meaningful collaboration to strengthen cleft care in India. Together, we have developed national protocols for diagnosis and management of cleft lip and palate, bringing together the expertise of fetal medicine experts, neonatologists, speech therapists, plastic surgeon, and maxillofacial surgeons as well. So, at Smile Train, we truly believe that every person deserves access to comprehensive, safe, and quality cleft care, no matter where they live. To make this vision a reality, we have established a dedicated cleft line, helpline number as well. Next slide, Harsha. So, here we have not just the surgery, we also focus on providing the comprehensive care treatment, which includes the nutrition, surgery, dental care aspects, ENT care, speech services. By surgery, I mean the secondary surgeries, then counseling and support. Next slide, Harsham. So at Smile Train, we have a dedicated cleft helpline which has received more than 9,500 calls since January, connecting more than 6,500 patients with free life-changing treatment across the country. Next. Today, over 47 partner hospitals in India offer comprehensive cleft care services under Smile Train's model of empowerment and collaboration. Another shining next slide, Harsha. Another shining example of such a partnership is Maha Smiles, where we have this flagship collaboration with Bajaj Finserv Health. Through this initiative, we aim to enable 8,000 live surgeries over the next 36 months, transforming lives and smiles across Maharashtra. Together with Foxy, our medical partners, and initiatives like Maha Smiles, we're building a future where no child suffers because of a cleft, and every smile finds its place in the world. Next slide. So our helpline number, I would repeat, is 1800-103-8301. So we have around 13 treatment centers across Maharashtra in 12 cities. I would request if you ever come across any children with cleft, please refer them or let them know about our toll-free cleft helpline. Yeah, thank you so much. And now I would like to introduce Dr. Monica and Dr. Supriya. Can you show me the CV, please?
Shalvi ma'am, good evening.
Hello, ma'am.
Yeah. Yeah, it is just 2 lines, ma'am. I'm the zonal coordinator for AMOX and I'm the chairperson elect for the Public Awareness Committee, Foxy. And I request Harsha to please play the inauguration slide so that we can take blessings of Lord Almighty before we start with the 3rd season, 24th episode of the Smile Train in association with AMOX. I would like to thank Dr. Kiran Kurtukoti sir and Dr. Bipin Pandit sir for their constant encouragement to carry these series forward. And we look forward to every episode, ma'am. Every month we have varied topics, including ultrasound for cleft lip, cleft palate diagnosis, antenatal counseling, the medical legal aspects. And today we have none other than Dr. Vaishali Chavan, madam, who will be speaking on difficulties in breastfeeding in cleft lip and cleft palate babies. So we welcome you, ma'am, and thank you for accepting our invitation. We also have Dr. Bharti Abdankar, madam, who is the Vice President-elect of AMOX, and Dr. Ajay Mane sir and Dr. Girish Mane sir as guest of honor. It is a pleasure to have you, sir, on this platform. And we start with the inauguration.
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय ॐ शान्ति शान्ति शान्तिः.
Thank you, Harsha. It is our pleasure to introduce Dr. Ajay Mane, sir. Sir has been the Vice President of Foxy, and sir is also the VP elect for AMOX. He has been working in the field of
Monica,
CCP and
we'll
DT.
skip
Yes,
this.
sir.
We'll skip this.
Sir, for your
Bharti
blessings then, sir.
Bharti ma'am is not joining.
Sir, madam is busy. She's in a case, and Girish sir is operating, sir. तर तुम्ही आहात,
Okay,
sir. जसं free झाले की sir येतो म्हटलं.
Yes, yes, no problem. Okay.
Yes, sir.
Yes, we'll start with.
Yes, sir.
Can we remove this?
Please stop sharing, Harsha. Yes, thank you.
Yeah. Thank you, Monica. And on behalf of AMOGS and PSC committee Foxy, then Public Awareness Committee के साथ में ये कौन है? Supriya, that is Adolescent Health. All are my near and dear committee. Dr. Madan, Dr. Girish, and the chairpersons Sudesh, Neha, and Sandeep Bhai from Nagpur, and our own speaker, the most talented person from Pune, Dr. Vaishali, ever smiling girl. I call her girl because she like that. So jokes apart, she's very near and dear friend of mine. So on only one call, she may come to any conference that Kari, तुमने बुलाया ना तो मैं आऊंगी. So and such a senior and knowledgeable fellow, but she don't have any एक्स्ट्रा गर्व ज्याला आपण म्हणतो मराठीमध्ये तसं काही नाहीये. त्यामुळं त्या सगळ्यांचं स्वागत. आणि आजचा टॉपिक फार महत्वाचा आहे. डिफिकल्टीज इन ब्रेस्ट फीडिंग इन द क्लेफ्ट लिप बेबीज. बेसिकली काय आहे की क्लेफ्ट लिप is not an indication for the MTP in second trimester. Should not be basically, because it is not a major disease or any syndrome or anything. It is a birth defect. So it should be treated as early as possible. Cleft lip, cleft palate, both in my hospital, when I was administrator in the MIT hospital, we have conducted around 3,400 cleft lip and cleft palate surgeries under the program of school education, which was conducted by government of Maharashtra. So I have seen so many cases, and it hampers everything. So we are waiting for Dr. Vaishali's talk. So I congratulate Monica for conducting this webinar. I'll be listening till the end. So I welcome all of you, the chairpersons. Sandeep Bhai दिख रहे हैं उधर से from Nagpur. Neha ma'am दिख रही है. And I think Sudesh has not joined. Okay, no problem.
Good evening,
And,
sir. Ajay
yeah,
sir, good evening.
काय म्हणताय? नमस्कार.
Namaskar, sir. Madan sir, namaskar.
Namaskar, namaskar.
Okay. And thank you, Monica, for inviting me here. I'm amongst you. I'm not guest of honor, but since nobody is there, I'm giving you all the best wishes. Thank you very much, and best luck, Vaishali, for your talk.
Yeah, thank you so much. Thank you.
Thank you. Thank you, sir. It is always a pleasure to have you on the platform because your words constantly encourage us to do better. And we have no better person to go through. If you have any other problems, Ajay sir is always there for any guidance that you want, whether it is legal, whether it is elections, whether it is Foxy, or whether it is AMOX. To go to is Dr. Ajay Mane, sir. So thank you so much for being there today. I would now request Dr. Madan Kamre, sir, to introduce our chairpersons, Dr. Sandeep, sir, and Neha, ma'am, for the talk. Before we start, Madan, best of luck
Thank you,
for
Dr.
all your
Monica.
future endeavors in Foxy. I request everyone
Thank you
to
so
please
much,
support his
Monica.
candidature.
Thank you. I'm happy to be part of this Smile train. and I'm happy to welcome today's chairpersons, Dr. Sudesh Doshi sir, currently the president of Pandharpur OBGY Society, senior obstetrician in Pandharpur. Next, Dr. Neha Lad, who is the currently president of Nasik OBGY Society, past vice president of NOGS and active member of NOGS. I welcome ma'am. Next, Dr. Sandeep Nikhade is the past president of OBGY Society of Nagpur and very active Foxian, my dear friend. I welcome Dr. Sandeep.
Thank you, sir.
I welcome all the chairpersons and I request to start the session by introducing our today's speaker, Dr. Vaishali ma'am. Over to you.
Yeah.
Yes, Sandeep, you can introduce.
Good evening, everyone. Dr. Vaishali Chavan is not a unknown person, and all the Foxians know her. She had done her clinical diploma in endoscopy from Germany. She is a clinical director of Cloud9 Hospitals, Kalyani Nagar, Pune. She is also director of Sanvi Clinic Women's Health Center. She is vice president of Pune Afghani Society for the year 25-26. And she was also a chairperson of Perinatology Committee Foxy for the year 2018-20.
Thank you, sir. Thank you.
She had multiple publications, and she is also a very good orator, and we are also a good friend. So, and for this upcoming elections, I request all the best wishes for from my side. And I request Dr. Vaishal Chavan to start her talk on the topic that cleft lip and the cleft palates are very, although not much common, but then the care required is immediate, and therefore this topic will enlighten all of us to how to care. And this Smile Foundation had done a tremendous job in this field. So it will be a great enlightening talk from Dr. Vaishal Chavan for all of us. So the cloud podium is yours now.
Thank you, Dr. Sandeep, for a very, very kind introduction. Best of all, I liked is you as a friend, and you truly are a great friend and the greatest endoscopist surgeon, I would say. I've been watching your work, so an amazing work that you are doing. And thank you for hosting us at Nagpur also.
Yeah, thank you.
Respected guest of honor, Dr.
By the way, sorry, Vaishali, I forgot it. Best luck from my side also to you and mother for your endeavor in
Yes.
Fox. Yeah.
Thank you, sir. Thank you.
Thank you so much.
We
Dr.
are
Ajay,
amongst
as you can
family.
see,
We are amongst family.
he is brilliance with great humor, and he's a very wise person, and he's everybody's friend, always there to help us. Thank you so much for your kind words. Dr. Neha, as chairperson, it's an honor for me that you are here. And of course, Dr. Monica, thank you for this very kind invitation. Dr. Madan, all the best to you. And you are a sure winner. Dr. Monica, as newly elected chairperson of PAC Committee Foxy, and along with AMOG's, this wonderful series that you have been conducting. Today is the 24th episode. So congratulations to the entire team of Maha Smiles, Cleft Care for Every Child, and truly great, tremendous amount of work that you are doing. So congratulations to all. Can I
Thank you,
share
ma'am.
screen? So my talk is the challenges in breastfeeding in a cleft lip or a cleft palate baby. And as we know that when this baby is born, there's a cleft lip and a cleft palate. So the function of suction and the successful breastfeeding, that whole mechanism is disrupted, and there are huge challenges in the breastfeeding. And when such a baby tries to breastfeed, many a times because of the break in the palate, the milk may go into the nose or eustachian tube, or there's high chances of aspiration. So these are certain slides which Foxy has given, and I'm going to go through this. Smile Train and Foxy have come together to draft protocol documents for diagnosis and management of cleft lip and cleft palate. And this was formulated when Dr. Nandita Palshetkar was President Fox in 2019. And I was also with Madam as chairperson Perinatology Committee during that time. And along with the innumerable projects Madam has done, this was one of the most important ones. The Smile Train and Foxy together formulating protocol documents. And this is a team of people who were actively involved. And there were a lot of fetal medicine experts, neonatologists, obstetricians, gynecologists, speech therapists, plastic surgeons, and maxillofacial surgeons. So, evaluation of the lip and palate is very important. And why is diagnosis very important? Because failure to diagnose a cleft palate is amounts to negligence. So at every anomaly scan, the baby, it is important to assess and to rule out cleft lip or cleft palate. In the first trimester, you should insist for a sagittal, axial, and coronal image, and in the second trimester, coronal, axial, and sagittal. So when you get anomaly scan and when you get the films, you should go through, every obstetrician should go through. If your radiologist or your fetal medicine concerned person has not taken these views, then it is important that we go back and we ask them to look for this. The coronal view is especially very important for the soft tissue, the fetal lips, and the appearance of the nostrils. And the axial view can analyze the fetal alveolar ridge that comprises the primary palate, and the mid sagittal plane usually demonstrates the fetal profile and highlights the contour of the nose and lips. So failure to pick up a cleft lip or a cleft palate amounts to negligence, and this has to be picked up at anomaly scan. So once the diagnosis is done, then diagnosis should be done by a specialized radiologist, fetal medicine person who does a detailed anomaly scan. And afterwards, a surgical team should explain the plan of the surgery, consultation of morphological problems. The pediatric, so it's a what it means is there's a multidisciplinary approach. To manage a cleft lip baby, you need this entire team of lactation consultant along with an obstetrician, a surgical team, pediatrician, psychologist, and so on. And you need to, especially psychologist and social and psychological support is very, very important for the parents, because parents go through a lot when they have a baby with cleft lip or cleft palate. So giving sympathy, sharing the experiences, all this is very, very important. So, what should be done? What are the timelines when the baby with cleft lip comes or cleft palate comes? So, after birth, as soon as baby is born, many a time, it's not just a solitary cleft palate or a solitary cleft lip. Many a times there could be associated anomalies. So, it's important to rule out if this baby has any other anomalies and clear the airway maintenance, and, of course, establishing the feeding, how to go about the feeding, planning the treatment plan, pre-surgical, orthopedic, infant orthopedicians can be involved. The immunization as per the schedule should be given at 9 to 18 months. So many a times the parents may ask you, when are you planning surgery? When is the right time to operate? The right time to operate is between 9 to 18 months. 6 to 12 months, an ENT reference is very important, because continuous, the milk going through the middle ear eustachian tube can lead to middle ear problems and can lead to hearing disability. At 2 years, you need to assess the baby, whether baby is growing properly or there's failure to thrive or the growth is below third percentile or so on. This baby may need speech therapy. Speech therapy may go on beyond 5 years of age, and 7 to 11 years alveolar bone graft surgery can also be planned. And in adolescent, nose correction, more of cosmetic correction, orthodontic surgery can be planned. So antenatal counseling plays a huge role. Many a time when antenatally the patient comes with a report of cleft palate, with cleft lip, and these patients, this couple is truly very disturbed, and what lies ahead of them, they are so anxious. So as obstetrician, it is very, very important to give this couple time to counsel them and explain to them that what really, they cannot visualize, they cannot understand what it really means. So it's important to show them maybe pictures, tell them about success stories, tell them about particular patient who has already gone through this kind of treatment. The anxiety is so much that many a times they say that we don't want this baby, just terminate the baby. And like Dr. Ajay said, cleft palate is not an indication for second trimester MTP. So it's important to counsel, reduce the anxiety, and advise against termination for the indication of cleft palate. When you are counseling the patient, and the patient is educated, you prepare the patient psychologically, you plan the treatment once baby comes, breastfeeding, what special care she's going to need to breastfeed successfully. Apart from this, genetic testing, potential for fetal surgical repair. So as of today, fetal repair does not happen in India. You can only diagnose cleft palate or cleft lip on level 2 ultrasound, but the treatment is only after the baby comes out, after the baby delivers, and after 9 months of age of the baby. That is when the treatment, surgical treatment, can be undertaken. So intrauterine treatment option is not really there. So it's important also to look for any other syndrome that is present apart from the cleft palate, to discuss the diagnosis, to discuss what to expect at birth, to make a protocol, a complete plan, and emphasize that how teamwork is so very important. And of course, to explain in such a language that they can understand, and early referral to cleft care center and so on. So immediately, airway management, establish feeding, examine the baby to rule out any other malformation, and lot of psychological support for the mother and the baby. Now, talking about incidence, the cleft lip and palate incidence is 0.8 to 2.7, 1,000 live births. In Asian population, it is 1.7 per 1,000 babies. Cleft lip and palate both together are more common in male. Only cleft lip is there, it is more common in males. Only cleft palate, if it is there, it's more common in female babies. And unilateral cleft lip, more on the left side, is there almost in 80% of the times it is the left side. So what are the risk factors? Nowadays common risk factors can be the retinoic acid, the excessive retinoic acid ingestion for the skin, for the dermatological issues the girls take, and exposure to this, especially in the first trimester, is a huge risk factor for cleft palate and cleft lip. Apart from this, genetics, yes, there is a genetic predominance, and closer the first degree relative, if the mother or father has, then the likelihood of baby having cleft palate is more. And also, if there's consanguineous marriage, when there's a consanguineous marriage, then the genes all obviously passed on, and that is the reason the risk is more. Apart from these, other factors like smoking, alcohol, folic acid deficiency, rubella, some anticonvulsant drugs, some antipsychotic drugs, and so on. So with a cleft lip baby, of course, there's a stigma that the parents feel. There's a huge amount of distress. They go through a lot of pain. And initially, once they overcome the shock of all this, and that is why, so that parents don't experience that shock, it's very important to counsel them properly antenatally. So when we come to breastfeeding, so what are these problems that they face in breastfeeding? First of all, the suction is not built. That suction is very important for them to withdraw the milk. The effective latching. Latching cannot happen because of the cleft lip. And there's no suction, or vacuum is not formed, and there's leakage of air. So the suck mechanism is very weak, and they do not form a good seal. So there's difficulty in breastfeeding. And if at all breastfeeding does happen, then the milk may go through the nose, or there's high risk of aspiration. And because of this weak sucking reflex, the milk production gradually goes down. Many a times there's nasal regurgitation. And when the baby is feeding, the baby feeds, and then goes to sleep. And there's this misconception that the baby has had enough milk and baby is now sleeping. But what in reality happens is that baby gets weak from just pulling and trying to suckle and trying to breastfeed. The baby gets tired and goes off to sleep. And all this leads to impaired growth and nutrition. So, cleft lip, cleft palate is due to the failure of fusion of maxillary prominence and medial nasal processes, some defect in the formation of the primary palate. They could be unilateral incomplete, unilateral complete, or bilateral complete. So, talking about breastfeeding. Now, cleft lip is a little bit easier to feed. Success rate is higher as compared to cleft palate. If the cleft lip, now this point is very important. If the cleft lip is on the right side, then the cross cradle position needs to be taken. It's important that the head of the baby is always up on the higher side to prevent regurgitation, to prevent aspiration. And when the cleft lip is on the left side, then the typical football, how the football hold that we say is what is required. So on the right side is a cross cradle position, and if the cleft lip is on the left side, the football position is important. Other position, important position, is the straddle position where the baby is held upright and then the breastfeeding is done. With this, what happens is the regurgitation, aspiration, the milk going through the nose, going through the nose and through the ear does not happen. So this upright straddle position is very important. So this is what is really recommended. And cleft palate can exist in various degrees of severity, right from a small fissure to an entire separation of the entire palate, including the gum. So, what is uncommon is the soft palate deformity is quite uncommon. So there is a difficulty in feeding. There are ear infection, there's hearing loss, there could be dental problems. If the cleft extends right up to the upper gum, then the teeth do not develop properly. There's speech difficulties and there's challenges of coping with the medical condition, the social, the emotional, the behavioral problems, and so on. So upright nursing hold, the straddle position is what is very important. And when the baby is trying to suckle, it's also important at the same time that mother tries to help the baby and pumps the milk, and care should be taken not to pump too much, because excessive milk in the mouth, sometimes these babies cannot gulp it down, and in such conditions the milk may come out. So it has to be done gradually. What if breastfeeding is not happening? There's a lactation consultant involved, and as obstetrician you are there, and the patient is also really trying, but still successful breastfeeding is not getting established. Then that is where other options come in. And these are special feeders. These are special bottles, and these are special feeders, and they are known as SNS, that is special need feeder. And you can see this bottle. This bottle is different. When it is put in the baby's mouth, it blocks the breach in the palate. So whatever breach is there, the cleft palate, this bottle blocks it. It is made in such a way so that once that is blocked, then there's no risk of the milk going through this gap in the palate. So it blocks the gap. And these are the different which are available in, and they're very commonly available and very commonly used by lactation consultant for cleft palate babies. And what is the difference between a normal bottle and the special need bottle? In the special need bottle, there's a valve, and because of that valve, the milk does not flow back, and it shuts that gap in the palate. And it can be speed control. There is like 1, 3, and 5. There are 3 regulations. So if you put on 1, then the milk goes in a slow speed. So it is a speed control, and gentle pumping action should also be given at the same time while feeding. So again, going back to what is this plan of treatment? Well, after birth, with consultation with parents, feeding advice, and then if they are mother is feeding effectively, if there's good weight gain, if there's has been successful breastfeeding established, all these needs to be reassessed. 8 to 12 months, cleft palate repair can be done. 1 to 2 years, hearing checkup to rule out middle ear collection. 2 to 4 years, watch for the development of speech. 4 to 6 years, speech improvement. 6 to 12 years, dental checkup and orthodontic treatment. In the teenage, sometimes the patients want some cosmetic surgery, correction of the nose, and so on. And as an adult, genetic counseling to reduce the inheritance of the defect. So there's this entire multidisciplinary team that is required, right from the obstetrician, the lactation consultant, the pediatrician, neonatologist, the plastic surgeon who's going to do this surgery, the speech therapist, the genetist to rule out later on the inheritance, the ENT surgeon to rule out hearing problem, and to care for the teeth, the orthodontist, pododontist, and prosthodontist. So it's important that you should encourage the parents, encourage that mother to breastfeed, provide breast milk whenever possible. And pumping should be also very important part in this breastfeeding journey for the mother. So pumping the excessive milk that comes, to feed with special feeders, to try to feed directly in the straddle position, and the benefits of different devices that are available. Mother should be taught how to use these different devices so that successful breastfeeding can be established. And consistent and expert counseling should be provided with experts in breastfeeding. So timely assessment support, ongoing support should be given. Follow up to see if breastfeeding has been established or if the baby is thriving. And there are certain peer support groups which these parents can join. And also look out for other kinds of syndrome. Find out what is the suitable feeding position that this mother and this baby, for them, this is the best position. So to find out that, teaching manual expression, teaching about breast pump, how to use it. Pumping is a very important factor in this journey of special needs breastfeeding of a cleft palate baby. Use of special feeding bottle, and of course to monitor if the baby has adequate weight gain. So what happens when the baby undergoes the cleft lip surgery? So it is said that as soon as the baby undergoes the cleft lip surgery, a baby can breastfeed immediately. And if the cleft palate has been repaired, then only 24 hours are required. After that, baby can breastfeed directly, immediately. So as we know, advantages of breastfeeding are huge. It gives immune protection, lowers risk of infection, helps minimize allergies, helps the digestive system mature, post-op nutrition, and of course it is economical also. And these are the this at this time in the antenatal classes, this is the time, this picture of Dr. Mangala Vani, well-known lactation consultant, this is the time to counsel, talk with the parents, and discuss with them the plan that yes, baby has cleft palate, how we are going to manage, how to go about, not to become anxious, not to panic, and so on. Preparing the mother to breastfeed once the baby comes is a very, very important part of these antenatal classes. Also, early skin to skin contact, evaluation of breastfeeding position, milk transfer, optimum expression techniques, and implementing strategies for maximizing milk transfer. Pumping is important, breast massage, and sometimes use of galactogogues can also be implemented. Encourage and guide about the support group, counsel about the success of breastfeeding, and also huge psychological support is what these parents need and what this mother needs. So many a times these mothers need to be educated about the different manual, different types, of breastfeeding, whatever is available, different bottles, special bottles, and so on. So with the end, I come to the end of my talk, and thank you once again, all of you, for this wonderful opportunity to be here. And I would really like to say that this is amazing work that Smile Train is doing along with Foxy and Amox. And this entire surgical treatment is free for the patients, for that baby. And there is a number which every obstetrician, every person, every healthcare care worker should know. And this is a toll-free number where you should contact. And every baby who needs surgery or treatment for cleft lip, cleft palate can avail it. And the number is 1-800-1038-301. And every doctor, healthcare personnel, and every person should take benefit of this huge amount of work that is being done. So thank you very much. Thank you all.
Yeah, it's a wonderful talk, Dr. Vaishali, and we all got excellent knowledge about this, the different positions of breastfeeding required during the initial days of breastfeeding, and then it's like a team approach in dealing with such type of patient, such type of babies, and this Smile Foundation had done a right thing for such parents to give them the psychological support and how to go ahead with the this anomaly. So I would like to thank Dr. Madan, then Dr. Monica Madam, Dr. Ajay Mane sir for giving me this opportunity. Any question from any other person, any other chairperson?
Mm.
Yes, actually, first
Sorry,
of
Jay.
all, let me thank Dr. Amox, Foxy, Dr. Monica ma'am, Dr. Madan, and Vaishali for a very good initiative. Actually, I have seen the Smile Train working with the plastic surgeons since long time, almost a 10 years plus. I am seeing one of my friend is doing a very good work with the Smile Train. And I was always wondering that we are solving this problem after the delivery, but can it be done something antenatally and with the gynecologist, which can help this cleft lip and cleft palate fetuses? Basically, as Dr. Ajay Mane said, that there is nothing wrong with the babies unless and until there is a part of some syndrome. But the visual appearance is so devastating for the parents, and that itself is killing. And then that was the reason many of the times the second trimester abortions were advised for these parents. But I think with the great work of Smile Train, the view of looking at these patients has really changed. And I must congratulate Dr. Vaishali. She has wonderfully, beautifully, she has highlighted all these concerns. And because I know that time, 10 years back, we are not aware about so much of how we should feed the baby. Most of the time, this baby used to land up into the malnutrition. Doing surgery was also a very difficult process. And as you told that you have to do a surgery between 9 to 8 months. So those 9 months, as a parent and as a obstetricians, we really need expert help. And I think your lecture has really done wonders, which has good awareness among the gynecologists also. And the training of the parents will be very important phenomena. I think this session and this program will definitely help for all
Yes.
of us to deal with this patient very differently. I think thank you very much for giving us this opportunity to be here and to listen to you, Vaishali. A great deliberation. Thank you.
Thank you,
Thank
Dr. Neha, for your expert comments, and thank you, Dr. Sandeep. Thank you very much. Yeah.
Yes. And
Thank
all
you,
the
Neha
best for
ma'am
your
and
yeah.
Sandeep sir for chairing this session. And Vaishali ma'am, thank you. But we have a few questions which we need to clear before we uh, go in for the quiz. First is how big the maternal milk supply be negatively impacted in the context of breastfeeding a cleft palate infant, and what are the interventions that can mitigate this problem, ma'am?
So that was one of the slides which I showed because of the poor suckling reflex. And there's a failure to establish successful breastfeeding initially. If that happens, then automatically the breast milk supply reduces. So it's very important, till the successful breastfeeding is established, the pumping has to be taught, and use of breast pump is very, very essential, especially in such conditions. And if at all required, you can introduce galactogogues also over a period of time.
And ma'am, the second question in the chat box is which three professionals play a central role in optimizing the feeding outcomes in cleft affected infants, and what are the distinct roles that you would expect?
So it is not only three, it's a multidisciplinary, and we saw that slide. There are 6 to 7 key players here. As soon as baby comes, the obstetrician, the neonatologist, the lactation consultant needs to be here, and we need to be prepared even before the baby comes. And parents are so anxious. So at this point, you can introduce the pediatric surgeon also who can discuss the plan with them. And later on, ENT surgeon is required, speech therapy as the baby grows older. So these people also come into the picture.
I think one of the very important thing will be training our nurses, because most of the time the feeding is done by the nursing staff. And I think we should have one lecture even for the nurses. They should get introduced to all these different techniques, and you have the special pumps available for this. And we should definitely think about, helping them out and training our nurses to feed these kids. I think that will be a very important.
Thank you, Vaishali ma'am. I think Harsha, we can start with the quiz now. And Neha ma'am, we have a Rishta program which is launched by Dr. Charulata Bapai madam in Foxy since last 2 years. And Rishta has a module of 6 sessions, which is meant for training of the staff nurses, ma'am. And it is in 6 regional languages. State-wise, we take it. I and Revati were taking it in Marathi. We had different hospitals who were enrolled, and 2 or 3 staff nurses from each hospital were trained in that program, ma'am.
Is it a online or it was a?
Yes, it's an online module, ma'am.
Okay, if you have any time further, you just let me, even our Nasik Vijay
Sure,
Society,
ma'am.
we can have our program for our staff.
Definitely, ma'am. And we wish you all the very best for the upcoming VPCon conference, ma'am.
Yeah, thank you. I'm expecting you all to come over there. Come down. It's a good program.
Yes.
I invite all of you for this.
So much.
I'll post the brochure in the
Thank you,
group
ma'am.
also, if you permit.
Sure, ma'am. Definitely.
Thank you.
Thank you.
Bye.
Madan
so
sir,
much.
over to
Thank you so much,
for the vote of
chairpersons.
thanks.
Vaishali ma'am, I miss your talk slightly.